WAJR. We welcome you back in, everybody. Tony Caridi along with Travis Rummel from HealthWorks Rehab and Fitness and Dr. Nick Zervos, orthopedic surgeon based here in Morgantown. And we've been talking about foot and ankle problems on this edition of the show of Ask the Experts. So let's get into some foot abnormalities here. Earlier on, we talked about high arches, low arches, but there's more significant things when you start talking about bunions and other issues. Nick, what do you see there?
Well, quite often we see that's one of the biggest complaints coming in is women, even men sometimes, or young females will have a bunion and claw toes or hammer toe deformities. And that makes the shoes hard to fit because there's bony prominences sticking where there's leather or shoe wear, and it rubs and gives them sore feet.
Okay, define a bunion for us. What's happening here? Where are we at?
Bunion's like the big toe deformity. It's like your thumb, but it's deformed in such a manner that it's angled, and at that joint, that angle creates a bump that sticks towards the inside of your shoe and rubs it. So that's the true bunion. And
the corrective measure is what?
You can try getting wider shoes, or you could try to realign the soft tissues or bone to make the bunion straight again.
Mm-hmm. And you
balance it out.
You mentioned claw toes as well.
Yeah, claw toes are the lesser toes, the second, third, fourth, or fifth, where they look like it sounds like a claw toe. They curl up, and the middle of the toe sticks up into the top of the shoe.
Again, a remedy for that is you do surgery on those?
Shoe wear changes, make a wider forefoot, or surgically realign that toe.
Yeah. Travis, on your end at HealthWorks, obviously people present with these kinds of situations. What are options that folks have from a physical therapy standpoint?
From a bunion standpoint, really treating the symptoms is probably what we do the most in physical therapy. It may be ice or ice massage on that to kind of calm the pain down. Sometimes even a pulsed ultrasound potentially. Those are probably the things we do the most for it. If the symptoms start calming down, we may even try like a A-stem, so kind of running the tools over top of the tissues. Those are some things we would consider doing.
Mm-hmm. Lastly, the Achilles and the ruptured Achilles. And I asked you guys earlier on, I said, is there anything you could do to be at least on the smart side as far as preventative stuff for ankle sprains? What about Achilles? Because I know when they pop, they pop. And Nick, you're just saying
you'll never know when it's coming. It's just like everybody comes in and says, I was just doing this and bang, I felt like a stick broke or a gunshot and I couldn't walk. So it's mostly sports, but there's often people just having a simple misstep. And it's a function of the age of that tendon, the vascularity of that tendon, the stiffness, and then it's like a rubber band. If you pull it slow, it's okay to stretch. If you pull it real fast, it's not ready. It goes slap, and it's in two pieces.
And that's a pretty significant recovery after a surgery from that, isn't it?
It's tolerable, but yeah, there's a 6-week period. You're not putting a lot of weight on it, but it's not like the old days where they threw you in a long cast with your toes pointing down and hoping it grows together real well. So when you surgically realign and tie that back together, we actually don't put a cast on. Just keep moving it, but don't put weight till it starts to heal.
Yeah.
So that's the aggressive, newer way, which is about 20 years in the making.
Yeah.
So.
And Travis, you guys see those as well, right? And is there PT coming off of those? I would imagine, huh?
Yeah, there's PT after a period of time. They're not necessarily in.
Oh, I have you in that week.
Do you have that? You have in?
Yeah, I have a PT program that starts day one.
Day one,
and it's not very difficult. So usually I'll have them come to you guys once a week and learn the new exercises because it changes on a weekly basis.
Yeah, I probably should have said PT. PT is physical therapy, so people go in after the surgery, they get physical therapy on that. Well, good deal, guys. We appreciate the visit, and we encourage folks to come out and see you, too, in person on Thursday night, August the 29th at HealthWorks' Maple Drive location. Again, it starts at 7 o'clock, and you've been listening to Dr. Nick Zervos and Travis Rummel. Travis with HealthWorks Rehab and Fitness. And again, if you'd like more information, just simply give them a call at 599-2515. That's 599-2515. Guys, thanks so much for being with us. We appreciate it.
Thanks for having us.
Yeah, thank you, Tony.
That'll do it. For Travis and Dr. Nick, I'm Tony Caridi. Thanks for being with us here on WAJR's Ask the Experts.